common signs could be a little bit of discomfort. There could be a little bit of pain sometimes in the armpit. If the breast tissue is anywhere else along the milk line, they may experience the same swelling. It starts with a growth, it slowly increases in size and becomes very big during your phases of hormonal growth spurts. And at times there could be a pain associated with. In the armpit, there are numerous nerves which are present. So while this accessory breast tissue is growing within the armpit, you will also see that feeling of pain at times. Few women experience the pain especially during their periods and menses. So it could be a little bit before the periods or during the periods. Obviously the tissue is being stimulated and it is surrounded by all the nerves, hence the pain. So a slowly growing swelling, if you notice in the armpit or anywhere along the milk line, you can suspect that you have an accessory breast tissue. It is called an axillary breast tissue because most commonly we see it in the armpit. Now, this breast tissue can happen either on one side of the armpit or the milk line, or it can happen on both the sides of the armpit. Some women come with us in more than 70 to 80% of the cases with a swelling in the armpit, either on one side or on both sides. Some complain of discomfort, swelling, and the swelling gradually increasing in size. One of the common things which occurs over a period of time is when you allow the swelling to grow, you will also notice the skin in the armpit areas getting stretched out. Hence, there is a laxity of skin. So many women come with a swelling in the armpit at a much later stage in life, and at that point the skin has stretched to a large extent because the swelling has grown, and sometimes the skin will be hanging very well below the armpit. So summarizing the signs and symptoms of an accessory breast tissue, if you notice a slowly growing swelling in your armpit starting at puberty and increasing in size and becoming very big, especially during your pregnancy. The swelling, once increasing, also decreases in size sometimes when you have completed your pregnancy and breastfeeding. How can we distinguish whether is it just an accessory breast tissue or is it a fat? Now, people who have fat, you will notice that when you start dieting, exercising and losing weight, most of the swelling may tend to shrink, because in the armpit, the breast tissue is also surrounded by a little bit of fatty tissue. So there is always a combination of little bit of fat along with that tissue enlargement. When you lose weight, and I always advise my patients that when they have these swelling, try to lose weight, try to exercise, do a lot of chest workouts, you will notice that some part of the swelling shrinks, and we know that some part of the fat is gone away. But even after losing all the fat, losing weight and exercises, if you still notice the lump, that means it is a true accessory breast tissue.